Hello, my name is Nicole Rawson. I'm the founder of Screen Time Clinic, and I have today with me Cristy Morales, and she is a licensed clinical social worker and a family therapist. We have worked together in the past. She is based in San Diego along with myself, so we have exchanged a lot of information over the years about digital media, how it's impacting youth and young adults, and even us as professionals. And Cristy has a lot of great insight to share with us today that I think so many parents and professionals will have an aha moment about, like, gosh, I was thinking that too. And that makes total sense because we have come to a lot of those conclusions together over the years, deciphering how digital media is really playing a role in our lives and our clients' lives. So Cristy, thank you so much for being here today. And do you want to add anything more about your qualifications and background? You've been practicing for a long time. We were just talking about that
I'm
too.
a dinosaur.
Yes.
Thank you, Nicole. Thanks for having me. Yes, I'm a dinosaur. Yes, I've been practicing, gosh, I don't want to do math, but like over 20 years in mental health with a specialty in children, but like I end up working with people of all ages, really. Um, Also a mom, so I get to see some of this in play at home as well, much to my kids' dismay. Hey, guess what I'm learning about? Let's try it here. Anyways, but yeah, no, that was, you pretty much summarized me.
Awesome. So let's get started right off the bat with talking about what you were saying, how the landscape has really changed in therapy over the years, because it used to be that you would go see a therapist, you would talk about some of the past, if I'm mistaken, and currently what is hampering your sense of self and happiness. A lot of people go to therapy because they are, for lack of a better word, unhappy and feel like there's more. They're at a lost potential stage and they need help finding that. And it used to be that therapy was a very effective in of itself, a way to decipher, decode, and forge a path forward. You want to talk
Yeah.
about that a little bit and when you saw things change?
Yeah, I would say it was a couple of years before COVID. I started noticing that some of my go-tos, like clients would come in and I'd be like, oh, easy peasy, here you go. We're going to do this. We're going to talk about that. We're going to work on this other thing. Some of my like standard, like this is foolproof, was just not as effective. And I'm like, okay, what's happening? What's changing? What am I missing? How is this like it used to be solid and now it's not? And I couldn't put my finger on it. So I spent several years trying to figure it out. And ultimately, it led me into my own path of discovering and finding you as well as somebody else to just like understand this better with how screens are interacting with humanity, really. Um, and I noticed all these mental health things that used to work weren't working. But then additionally, I was noticing that all of these diagnoses that used to be like rare, like dissociative identity disorder, previously known as like multiple personalities, you start seeing more of these. And I was just like, well, that's also strange, right?
Mhm.
And then looking at some of my clients, physical health histories that would come in as they came in, I'm seeing all these abnormal, like previously unseen physical health diagnoses. And I'm just like, okay, physical health diagnoses that used to be rare, mental health diagnoses that used to be rare, things that didn't used to like things that used to work not working.
Same type of families, same demographic,
Mm-hmm.
same
Yeah.
location. You didn't move. There was nothing else significantly different.
No, no. And so, that's what ultimately I landed on screens. And it's one of those things like hindsight, oh my gosh, how did I not see this? How did I not understand that? Right. But in the moment, as I was seeing all these other things, I didn't see that because we didn't, I think, realize the intensity as a professional or as a parent, how this is like seeping into our lives, in our
Yes.
brains,
Yes, it's
and
true.
our health.
Right. And even the digital addiction for gaming addiction was only recently added to the DSM-5 is that the right term? As a recognized disorder.
Hmm.
Um,
Yeah.
and then so that helped a little bit, but in my experience, there were very few professionals that were even cognizant of video game addiction. And that, I worked with plenty of people who said, well, your only source, the only seemingly healthy area of your life are the few friends that you have through the video games. So
Yeah.
let's not cut that out, but let's try other areas. That was very, very common across the board.
It
Even
was
with my
super.
own son,
Yeah.
15 years ago. And
Yeah.
that was very frustrating for me because I was a teacher and into screen time, and his therapist really insisted, like, no, this, fix what you can. Don't be creating more problems and
Yeah,
more points of friction by
right.
removing something that was so seemingly innocuous.
Right, right. No, and you're not wrong. Like you're saying that was 15 years ago. I've even more recently, maybe within the last 5 years, chatted with professionals, therapists who are specializing in screens. And it was kind of appalling to see they still are kind of struggling with how to do that and still saying, well, at least they have friends. And it's interesting that you bring that up because I do think that I am seeing more and more clients who are substituting any kind of friendship for only virtual friends, right? Which I'm equating to like, oh, well, French fries is a food. Let's all just eat French fries for the rest of our life, right? Like, yeah, virtual friends, that's something, but like let's keep the in-person friends because I see a huge difference. And actually one of the common homework assignments now, speaking, previously there were my go-tos of like this will definitely work, and then they stopped working. One of my common go-to assignments now for clients is get out in person, meet people, make friends, have like real life connections, people that you can like sit down and touch every week if you wanted to.
Yeah, it sounds so simple. And I don't think we knew until recently what complex equation it is to become a healthy human, especially for children in the developing brain. Like, why is it important that they go play soccer and waste our time as moms with all these different activities that they really don't even want to go to and make our
Hmm.
life more difficult? They complain about going, and sometimes it seems like there's very little benefit, but all of that friction is actually stimulating that part of their brain that causes confidence and causes them to really feel fulfilled and learn how to build friendships and learn how to get along in life, because online is frictionless unless you
Right.
make it so, because you
No,
can
as soon
log
as they
off.
hit friction, they're just like, okay, I'm logging off now, right?
Yes,
And it's
yes,
human beings, we're meant to feel distress because that's how we grow, that's how we get stronger. I,
yes.
I heard something about trees once, and when trees are growing, they're meant to feel like wind pulling and pushing at them so that their roots get stronger. I think that's us as humans. And we've basically taken away that. And so people they don't feel distressed. I've seen now people just from boredom get into a full-blown crisis. And by full-blown crisis, I mean like suicidal attempts from boredom,
Mm-hmm.
right? Like
Mm-hmm.
we're meant to feel all the feelings. And boredom seems like one of the more benign feelings, right? Like nobody enjoys it, but like people are actually attempting suicide because of it. That's concerning.
Yes, yes, definitely. And that's another feeling that needs to be practiced. And this, okay, mom, I'm bored. Well, be bored. The tough love part of
Well,
not
that's where the
having anything,
creativity is
the
going to come.
true creativity, not the building blocks of Minecraft,
Mm-hmm.
Roblox, that
Mm-hmm.
automatically setting you up for success and
Mm-hmm.
showing you a pathway that you will be successful and giving you
Yeah.
this false sense of security. I mean, this is all so craftily marketed to kids and parents to make
Mm-hmm.
them believe that A, it's safe online, when we know Minecraft, Roblox are getting sued right now for all the online predators and the lack of
Yeah.
systems that they have.
Yeah.
And because they're mixing adults and children together on a largely adult platform that's
Mm-hmm.
unmoderated. And then also the creativity, they're creating and they're meant to be successful. Otherwise, they wouldn't keep logging on. I mean, it's just
Mm-hmm.
so sophisticated, and year over year, day over day, it gets more powerful. And that's the other thing I've seen, is that there isn't such a thing as moderation anymore either,
No. No,
because
there's not.
so obsessive, even a little bit makes you think about it, makes the kids, particularly kids with their developing brains, they become so easily obsessed. And that's that OCD pathway that's
Mm-hmm.
being stimulated. So any sort of obsession we're seeing is
Mm-hmm.
OCD and causing anxiety and that whole rabbit hole. And
Yeah.
even if they're only allowed to play on weekends, if they have a genetic component of addictive family history or perhaps autism, ADHD,
It's going to get triggered.
it's going to get triggered, and they're going to want it more and more. And they're going to be in a seeking mindset, just like drugs,
Mm-hmm.
would you say,
Mm-hmm. Mm-hmm.
thinking about, okay,
Exactly
well,
like
how can
drugs.
I plan my weekend so I can meet so and so online at 2 o'clock? Does that mean that I can't go to my soccer game because 2 o'clock is going to come around? Or what sort of satisfying behavior do I need to pretend? How long
Mm-hmm.
do you pretend that you're okay so you can
Mm-hmm.
get your end means of time online?
Mm-hmm.
And that's not genuine behavior either, right? You want to
No,
think
no.
about.
I have clients that will come in And the way that their parents got them to come in is with the promise of screens afterwards. And so then after about 5 minutes, they're like, okay, are we done? How long do I have to stay here? And I'm just like, oh, wow, this like that didn't used to be. They used to be like happy to come in and play with my toys and talk to me and let me allow space for their feelings and their thoughts to be important.
Yes.
So,
And can you notice that is it just what they're talking about or in the waiting room? What cues do you, or they tell
oh,
you, or the
some of
parents?
my younger clients literally are just direct. They're like, my parent promised that I get to go and play 30 minutes on my game when I get home. So can we leave now? Is
Yeah.
it time? Can I go? Are we done?
Yeah.
And
It's
it's just
amazing.
never before was that like, yeah. I mean, at most, maybe before a parent would say, like, okay, we're going to go to therapy and then I'll get you like candy afterwards or something, right?
Right.
But
Right.
even with the candy, they weren't like rushing to get out my door.
Right.
So,
Right.
yeah, no, it's interesting. And I mean, honestly, so the heart of what I was seeing so many years ago really came down to screens and their addictive nature. And they're just that immediate escape. They don't have to exist in the real world, right? So the more times they're spending with screen, the increase is there with anxiety disorders, ADHD, dissociative identity, time blindness, inability to set or maintain routines, which you kind of alluded to earlier, fatigue, joint pain, fainting, just overall body aches and stiffness and headaches and brain fog, digestive issues, sleep issues. Like I'm seeing all of these things when my clients think I'm crazy when I'm like, hey, let's talk about maybe screens and doing a digital detox. And I know somebody that would be great. And they just look at me like I'm crazy.
Right.
But but when they go that direction, right? And some of them have directly gone that direction. Some of them have accidentally gone that direction. Like my
Natural
phone,
consequence.
my phone got broken and I didn't have money to afford to fix it for a month, right? And then it becomes, well, what did you notice in that month? And lo and behold, I have people that have had full-blown like medical diagnoses of different like special, joint or body aches and, like all the way to like notes to get them out of PE,
Mhm.
right? Because my kid can't. My kid can't move their body like that. And then suddenly after a screen detox, they're playing on a sports team happily,
Yeah. It's
you know?
really, really incredible. And I wish that we do see this in Utah right now that they're making a digital detox the first line of action before prescribing medication to children. That to get down to a neurological baseline, if parents think that medication or that a therapist thinks medication is necessary, they're really insisting to do a digital detox first and then reevaluate the necessity to prescribe
I
because
think that is great.
yes, and it really resolves so much stuff that people are just very unbelieved that it will actually fix so much in such a short amount of time. And the other thing is when medication is prescribed and you do have a heavy digital environment, it greatly reduces the impact and sometimes it's not helpful at all.
I have seen some of my people that I've sent for a detox that have like accidentally stumbled across it. Then they're able to like reduce medication. I even had a client that when I say, well, tell me about the ADHD, the answer is what ADHD? I don't notice it anymore.
Mhm.
So it definitely like a reduction for those that were taking medication, a reduction in medication almost every time.
Mhm.
Um, and to the point where, like I said, some people saying like, the physical diagnoses of, that led to my child can't participate in PE, whatever, the fainting, the joint stiffness, the whatever it was, right? Um, so yeah, I love that you taught us doing that. I hope it catches.
Yeah, well, they're usually forefront on things like this, so I think it will. But a lot of times it's up to parents to really say and talk about this with their child's therapist and say, hey, we'd be open to this. What do you think about this? Or to find someone who would go along and guide with them and be the supportive person. Because I've talked with therapists at networking events, and they have told me
Mhm.
point blank, if I ever suggested to a parent to do a digital detox, I wouldn't have any more clients.
Mhm. Yeah,
So
no, when
it's
I
like,
suggest it to parents or to clients, they kind of look at me like, what now? But it's also a matter of like, I usually wait until they trust me, until they know that like I really am not just randomly suggesting things for no good reason.
yep, yep, absolutely.
And
But
as a parent, I know how hard it is too, like what parent hasn't had the break of like, oh, here, just watch a show while I get, 30 minutes of a break of not having to parent you for that time.
Yes, yes. And you've seen too with clients that I've worked with that are in your care also that it does take a lot of parent responsibility. This isn't just sending your child to therapy or to a session of whatever it may be. I mean, a lot of the people we work with have such a heavy schedule of all the different activities, all the different interventions, sometimes spending a lot of money on neurological interventions that don't address screen time, that
Yeah.
they're just child-based,
Yeah.
trying to reprogram their brain or their bodies or whatever it may be. But a digital detox really does depend on the parents
Hmm.
setting up the home environment, the expectations, and the routine differently. And do you want to talk a little bit about that, like how it's from families that you've worked with? Like, it seems like a lot, but it's more possible, achievable. It's not as inconceivable as they might think. And it's really a necessary component when you have a sick child.
Yeah.
This is part of your parental responsibility to try different things at
Yeah.
home too. And a lot of that goes through coaching
Yeah.
and not therapy.
Yeah, no, absolutely. Just somebody there to support and, get you going the direction that is going to be the best you as a parent, as a family. No, absolutely. That's where coaching can kick in. And I have people beg me, hey, Cristy, can you see my kid 3 times a week? Can you see them 4 times a week? And I said, no. I mean, like, technically, yes, but no. Like, that's
Right.
not going to be healthy for them. And, the huge message there is I want you to fix my kid, but I don't want to have to like
Right.
lift my fingers or and establishing any new routine is hard. Like think about, okay, I'm going to go to the gym every morning. Like
Right.
that's hard. Even
Right.
even I have clients that are struggling with a routine on taking a medication every day,
Yep.
right?
Yep.
And the thing that I always say, and I usually say it on medication, but it's true on the screen time detox too, and just reshaping like how screens are interacting with, your family, with your household, with your life. When it starts working, then you're motivated to do it,
Yes.
right?
Yes. Yep.
And a,
Just
a
like
class.
feeling better when you go to the gym and then losing a little bit of weight or whatever it may
Mhm.
be.
Yeah, a classic example, my clients here, because I'll throw out my personal stuff here and there, is that I didn't always used to have to eat gluten-free, but at a certain point in my life, something shifted, something changed, and I realized, oh, if I don't eat gluten, 85% of my headaches go away.
Yes.
I'm hooked, Like, is it easy to go in the world and avoid eating gluten? No, especially in a world where there's like bread and gluten everywhere, right? But you find the motivation to do it because feeling healthy feels good. I
Yep.
like having 85% less headaches, right? And for my clients that realize a screen detox and reshaping how they interact with screens moving forward is
It's
beneficial in that
wonderful.
same way, they're going to find the motivation to do it. Was it really hard for me to learn how to eat gluten free? It was so hard.
Yeah.
But is it worth it? So worth it, right?
Yes.
And that's what I think that clients find when they finally get there. But much like the therapist that you said you've, run into where they said we wouldn't have any clients if we told them that, they're slow to warm up to it, but you can gently get them there. I've had clients that going back, can you see my kid 3 times a week? Can you see them 4 times a week? Can you do more? Can you do more? Every time they ask, when I see that screens are a part of the puzzle,
Mm-hmm.
I put that as the first thing. And then I give them 2 or 3 little things that maybe they'll do. And
Mm-hmm.
then they ask again and they ask on repeat, like, you know, frantically texting and calling. I think I need to hospitalize my kid. They're calling out of school again for the fourth time in the week and we're only on day 4, like just different things. And I always go back to it gently. Here's my recommendations and screen detox is there. And I just keep putting it back. And eventually they're like, okay, let's talk about the screen detox.
Yeah. Yeah. Absolutely. Because it really does. It's kind of like we call it like a screen allergy now too.
Hmm.
If your child had a gluten allergy, would you just keep on giving them the same food that you've always been cooking because it's too inconvenient to learn how to cook differently, to
Hmm.
inconvenience the other members of the family, to
Hmm.
inconvenience yourself? No, you wouldn't, because it's physically making them sick. And that's
Right.
the same thing with screen time, is that we know this can be fixed, it can be modified, and some kids are much more sensitive than others. So
Hmm.
it makes sense to really go with a clean slate. The
Hmm.
degree of digital detox is something that a professional like myself or someone who's really knowledgeable about what screens they have in their life. Are they on online programming at school? How
Hmm.
much of this digital ecosystem is what the American Pediatric Association is now talking about. They've finally moved away to their 1 to 2 hours a day recommendation, which it's like, was that 1 hours a day or was it two? Was it, 4 joints or is it just 2 joints of marijuana? Like, how much
Yeah.
is enough to make a kid high?
Yeah.
But
And it honestly depends on the kid, like you
it
said.
does. It does.
I've seen kids have drastic effects just from the most benign of TV
Yeah.
shows, right? And I've seen some kids that don't seem affected by TV or movies, but maybe they're affected by video games,
Mhm,
right? Um,
exactly. And you can't tell until the easiest way is to do, that's why we do the digital detox, remove it all and then
mhm,
add more back methodically because it comes from the most surprising of places sometimes. And it
right.
depends of the age too. And we're seeing toddlers with the toxic cartoons, the fast-paced cartoons now that those are overstimulating or ed tech. There was a big article
Hmm.
about how ed tech is big tech and it's been in our lives for about 15 years and it hasn't had a discernible difference in learning benchmarks, sadly. So
Yeah.
Norway
Yeah.
is going back to blackout classrooms where they're going back to pen and paper and learning the old-fashioned way because neurologically it's helping their children become healthier, more critical thinkers. You were talking about
Yeah.
creativity, just this sense of being
I
and
mean, even if you're talking about like pen and paper, I've talked to people who are teachers, and they say that if they ask their students to do something with pen and paper, they have students complaining about how their hand hurts or this, and I'm thinking that a simple assignment, we used to write our whole, again, I'm a dinosaur. We used to write our whole paper by hand,
Yes.
right?
And it stimulates a different part of your brain. We have seen
Hmm.
this with screen time studies, and that part of the brain is protective against autism. It's actually one of the markers when you are being screened for ADHD and autism or dysgraphia and how you're
Hmm.
holding a pen and moving it. Not because we want your kid to have perfect handwriting, but
Right.
because that little movement is connected to the brain, the body, and it's stimulating a different neural pathway. And like you said, patience, boredom, all
Yeah.
these muscles, learning all these little things that are so important. So,
Yeah. And
yeah,
it's interesting. I've had clients like speaking of like attention span and speaking of, being on the spectrum or not being on the spectrum. And that's definitely, I would say the biggest one I've seen an increase on. But I've had clients describe to me like the realization, and these are usually my young 20, 30-year olds. I used to love to read. Now I can't even tolerate an audiobook. Like
yes,
their attention, like realizing that their attention span is going down, that their abilities are going down. Some of them saying that they can't even have a full movie or even a whole episode of a show,
yes,
right?
yes, yes. I see that with even with the kids in their 20s right now. And so
Hmm.
my kids are older in their 20s and their friends that you ask them what movie they've seen, they're like, "What? We don't watch movies." But it's because of that inability to watch a longer formatted show. But that's what calms the brain down and leads to that critical thinking and the comfortableness with yourself in your own skin. So
And
this,
I've had some clients that do a longer show, but on double time. So they speed up the
uh,
playback time.
uh,
And when I hear that and see that, and just like my brain is like, wow,
yeah,
okay.
yeah. And so maybe if you're watching this right now and you're like, "Oh, I do that," or that makes sense. This, it's not ideal because this isn't how we're evolving. We know we're not evolving in this direction because we're so unhealthy right now. There's so many very
Yeah.
severe mental problems, health problems. The metaverse is not the solution. We're not all going to be wearing goggles and happy and healthy at home. We thought maybe that was the case, but turns out we actually have to really work on being human. And the only way to do that is to practice. And
Yeah.
it's amazing how it can be undone so quickly.
Yeah.
This huge change in kids. I mean, I just love working with families with kids because the neuroplasticity and the amount for these kids to change is amazing. What have you seen when you're a little bit older and 20s? What do you see with the clients that you've had? How long does it take for them to be like, oh, I am feeling better?
It depends on how seriously they do it, right? Like I have some
Yeah.
clients that will start with, and especially my older clients who are like controlling it themselves or trying to control it themselves,
Mhm.
they'll maybe start with like the one that they spend the most time on. So if I
Cut
spend
that
the most
out.
time
Yeah.
on TikTok, I'm going to like cut that out or I'm going to put
Yeah.
my own parental controls. But for the ones that, like just jump all the way in and they're
Yep.
like, I'm going to try a solid week with nothing.
Yep.
It's amazing how quick they start to feel better. They start to sleep better. You know, I had
Mhm.
somebody tell me that they were having issues sleeping, and all they did, they didn't even do a full detox. All they did was decide to turn their phone off and keep it like in another room where they didn't even see it,
Yes.
starting at 8 o'clock,
Yes,
you
I've
know?
had a lot of those clients too. And a lot of them have aura rings where, or
Hmm.
that they can see even not just anecdotally, wow, I slept so good, but they're like, oh my gosh, and my aura ring said I had amazing sleep too.
Right, right. So like the person that had told me like, okay, this is what I've done. This is the one piece I could move. 8 o'clock on, no
Mhm.
screens of any
Mhm.
kind. And it was like, it was no phone, it was no TV, it was no nothing. Suddenly they were sleeping better. And they said that the other thing they noticed is they were thinking better, like things that were a work problem or a school problem the next day, they quickly solved it. And it just felt like the wheels were greased, is what they said, right?
Awesome.
And that was just from one little change,
Yeah.
right?
Yeah, but that
Um,
has a big cumulative effect when you're not partaking in digital media after 8 p.m.
mhm.
on a yeah, that's
Yeah. The starting point that I try to get most of my clients to is at least please don't sleep with it in your room,
yeah,
right?
definitely.
Leave it to charge outside of your room. Find a different way to wake yourself up in the morning. Um, Aim to have, like, if they're not ready to jump into a full detox, I try to get them to aim to have, like, okay, I'm never going to bring it to the table with me. I'm never going to bring it to the bathroom. That's kind of gross anyways. We shouldn't, but
Yeah, the
um,
natural stopping cues
yeah,
when you
yeah. Or
transition from
what
parts
I
of your
call
life.
like divorcing, because think about it, people go through their whole day with it in their hand, touching
Hmm.
them, if it's sitting in their pocket,
Hmm.
feeling every vibration that comes through. So, I just say, can you find like little mini splits that you
Yes.
have with your device?
Conscious
Um,
uncoupling. I always say it's
hmm
like the most abusive relationship we have right now is with our phone because we think it's so great for us and it provides so much pleasure, but it's really undermining all the great things that we're capable of and our happiness too.
Yeah, yeah. The two things I think, so going back to where I started, things that used to work weren't working. The
Yes.
two things that I go to most often now is face-to-face time with somebody,
Hmm.
make friends, meet people, and single focus throughout the day, meaning do something where that is the only thing you're doing. Maybe it's the dishes and you're only doing the dishes. You're not listening to music, you're not watching a podcast, you're
Yeah.
not talking on the phone. It could be simple, something like that.
Yeah.
Those are kind of the two like biggest things that I go back to. And for the clients that are ready to tackle it, absolutely a full-blown detox. And that's where like you get the biggest bang for your buck.
Yeah. Yeah. But tell us some things that you've noticed that are some red flags for parents that if they notice things like this that aren't improving with therapy or even medication, that really would be helped with a digital detox.
Yeah, I definitely see a lot of clients with like just decrease in basic daily living, eating, drinking, hygiene. And when they describe it, they describe, well, I'm too tired. I don't have the energy. They describe it as fatigue. It probably looks a lot more like depression. Sometimes it looks like anxiety, like I don't want to get up and get out of my room or even go outside the house.
School
And
avoidance.
school avoidance is like one of the classic things I see. And I used to be an advocate that when necessary, sure, go to online schooling or, homeschool. But I feel like that just makes the problem worse because
Yes.
then now they have no reason to get out of
Yeah.
bed,
Yes.
right? And they're literally staying in bed all day from gaming and scrolling on their phone to doing school. And doing school just gets worse and worse because again, they're not seeing
Yeah.
face-to-face people at all. They're not getting challenged. They're not like experiencing distress and seeing that they can work through it and getting stronger. So I'll have families that will just be like, no, I think I need to go to homeschool because I just don't want them to fail. I don't want them to fall behind on their schooling. Kind of like you were saying with your son, where they're like, let's work on the things that we can work on, but leave the things that we think are going well alone.
Creating all these less stress points. That's the weird, parents are trying to help, but
Hmm.
they're lowering all the barriers to stress so far low
Hmm.
that the kids are just sinking into this hole deeper and deeper and deeper, even though the parents are trying all these different avenues to decrease the stress and decrease these friction points.
Yeah. Yeah. So I don't know. I think the activities of daily living is
Yeah.
probably one of the number one things that, and many parents will say, well, they're an adolescent and,
Or they're
you
getting good
know,
grades online. I've had that too, then too.
uh-huh.
Oh, well, he gets straight A's, or there's not a problem. He's making money, but all the other human benchmarks, like you were talking about, are
Yeah.
in severe dysfunction. So yes. And they don't even have to be severe dysfunction. I shouldn't even say that, because there's a lot of cases where kids really aren't performing at their true potential. And maybe they're performing okay, just like a functional alcoholic, I would say.
That's a
Someone
great comparison.
that recreationally drinks. I mean, even myself, I've gone from drinking wine with friends and doing a little bit of alcohol to none over this past year. And it's amazing the different things I choose now to go do, and the extra time it's opened up, even though
in the ways that it was probably like trickling out that you didn't even realize.
Yes, neurologically agitating for sure, that, sleeping better, more patient, just my whole demeanor has probably changed. And that wasn't even from a lot of drinking. And I think that's the same. Digital media is a neurological agitator, just like alcohol consumption. And we know for kids that abuse alcohol when they're young. I don't know, did you have many clients where they were young drug users back in the day?
I've had
that doesn't happen anymore.
I've had a few, but I was about to say that it's less popular now.
Yes, I know.
Like if they're learning one thing, they're learning that like, oh, maybe I don't dabble in drugs and alcohol that much.
But that was it was more easily identifiable back then, that like, wow, your child is drunk. Like they're going out party, they can't get
coming to a parent and saying like, hey, I think we need to talk about their substance use. Parents are like, yes, absolutely we do. Yes. But coming to a parent and saying, can we talk about their screen use? They're like, oh, no, I don't think it's that. Yeah. Exactly. Well, and I've had conversations with pediatricians when I've talked about like, hey, this decrease in, their like eating and drinking and just overall hygiene. And they said, well, what do you think happens when they don't drink enough or eat enough or move their body enough during the day? Think about it. If I've sat in my bed all day on my computer or my phone or whatever, and then all of a sudden I get up and I haven't eaten and I haven't drank and I haven't taken care of myself, the pediatrician was like, what do you expect? They're probably going to like feel faint. They're probably going to pass out. They're probably going to have very low energy or pains and aches in their body. Like if I sit too long on a car ride, my body's kind of like
very unnatural. Yeah. We're meant to be moving. We're meant to be in companion with other people and seeing other people in our natural environment too. That's maybe we'll end on this food for thought, is that to be in your own community, in your city, in your town, with your family, with the people that you are put together in a school, like that is your mirror of life and who you are, and people that really care about you and how to make yourself act and behave so you can fit within your community and fit within your family. If you can't make peace in your family, you're gonna have a real hard time as an adult making peace with people that you don't like to get along with. So
I definitely tell my kids that all the time. I'm like, we're the practice.
Yes.
We're the practice ground for you to like be social with other people.
Exactly. If kids are making their parents miserable and causing concern, that it's not going to magically disappear into the real world later. So here to help.
And it doesn't.
Yeah. And there's just so many more resources now, and integrative treatment, I think, like you're seeing with Cristy, being knowledgeable about this. And of course, myself, we can help you too. So if this has resonated with you, feel free to reach out to us or to Cristy. And we both do online sessions virtually, or if you're in the San Diego area, of course. But hope this has sparked some interest and greater conversation. So thanks, Cristy, for talking today. And
thanks for having me.
We'll catch up with you again.
Okay, sounds good.